Daniel Porro has been advocating for the mentally ill for more than a decade. His biggest challenge is helping them get jobs in the Bronx, where the unemployment rate is close to 13%, the highest among all New York State counties.
There's already a hiring freeze. So it's not like as soon as they open the doors that we're going to be the first ones in the door. It's not usually that way. We're usually the last ones.
Porro's been the co-chair of the Bronx Mental Health Council since 2000 and goes to almost every mental health function there is. The Bronx native says he hears about the same issues over and over.
It's important to them to maintain, their stability at home, their environment at home, and it's so hard for them to get a job.
Pam Bates, who has been mentally ill for several years, hopes employers will cut her a break despite her acute depression.
People still, they think that if you have a disability, you're going to be going to doctor's appointments, you're going to be out sick.
Porro suffered from depression himself after losing his job in 1998. Now he lives on Social Security, doing only volunteer work. He thinks local businesses could help more.
We are being recognized and acknowledged, but they're not opening the doors and hiring us fast enough. And it ought to start at home, where you call your community, your neighborhood, where you have roots.
Porro is frustrated with the Bronx elected officials he says don't do enough for the mentally ill.
You either need to step down and let some new blood come in with new ideas, or you need to address the issues.
But he says the burden shouldn't fall entirely on local government.
This is a collective thing that we all have to do together.
Kenny Agosto used to help the mentally ill and those with other disabilities find jobs. He believes educating employers could be useful.
People don't know the different aspects of mental illness, or they don't know what the different aspects of developmental illness or learning disabilities for that matter. So I think that there has to be a greater understanding of our individuality.
Daniel Porro says more needs to be done in the mental health community. He'd like to see government, advocates, and the mentally ill all work together on fixing mental health issues. For Stony Brook News, I'm Jason Van Hoven.